What if I told you that a simple yet powerful drink, which numerous studies have shown, can reduce the relative risk of a heart attack or stroke by more than 50%, isn't some expensive new drug, but rather a humble ingredient that's likely in your kitchen right now? Hello, and welcome to Senior Forward Health. I often wondered why garlic wasn't used as a primary medicine for heart conditions, and then I realized it's simply because there's no profit to be made from a plant that anyone can grow in their backyard. So today, I'm going to pull back the curtain and show you a remarkably simple and inexpensive special recipe I call garlic water. Of course, it's important to remember that nothing I say is intended to diagnose or replace the personalized care you receive from your medical team. Please always consult with your physician before making any changes to your health routine. Many studies have confirmed that garlic is incredibly effective at lowering blood pressure. But ladies and gentlemen, that's just the tip of the iceberg of what this incredible plant can do for your heart and your entire cardiovascular system. Today, we're going to explore the top 5 benefits of garlic specifically for seniors to help prevent strokes and heart attacks. We'll dive deep into how it works on a chemical level to protect you, and I'll show you exactly how to prepare it for maximum benefit. Before we focus on the heart, it is important to understand that garlic is a powerful full-body protector, and its other benefits all contribute to a healthier cardiovascular system by reducing one of the key enemies of our arteries' inflammation. First, garlic has potent antiviral properties. Most common colds are caused by viruses, and you should consider eating garlic at the very first sign of symptoms like a scratchy throat or a runny nose. This is critically important for your heart health because every single time your body has to fight off an infection, it triggers a system-wide inflammatory response. Think of inflammation as a fire inside your body. While it's a necessary part of healing in the short term, chronic low-grade inflammation is like a slow-burning fire that damages the delicate inner lining of your blood vessels, setting the stage for heart disease. Second, garlic possesses remarkable antifungal capabilities. For instance, if you've ever had a candida infection, which often appears as a persistent white coating on your tongue, garlic is a powerful natural solution. This condition is very common after a course of antibiotics. Those medications are like a bomb in your gut, wiping out not just the bad bacteria, but also the friendly bacteria that help keep fungus in check. When that natural control system is gone, fungus can overgrow. Just like a viral infection, this fungal overgrowth contributes to that same chronic inflammation that is so detrimental to your blood vessels. Garlic is also a potent antibacterial agent. It acts as a natural antibiotic and has been shown to be effective against serious bacteria like tuberculosis and H. pylori. H. pylori is particularly relevant because it not only causes stomach ulcers, but has also been directly linked to inflammation of the arteries. Garlic is also an effective antiparasitic, helping your body eliminate worms and other parasites. The overall goal of all these actions is the same, to reduce the total burden on your immune system. When your immune system isn't constantly fighting off these low-level invaders, the chronic inflammation throughout your body goes down, and your blood vessels can finally begin to heal. And this leads to one of the most crucial points, garlic's power to address the root of so many health problems by improving insulin resistance. Chronically high levels of insulin in your blood don't just lead to issues like a fatty liver. Insulin itself is a highly inflammatory hormone. It directly causes inflammation and hardening of your artery walls, creating the perfect environment for dangerous blood clots to form, which are the direct cause of a heart attack or a stroke. By helping to lower insulin and improve your body's sensitivity to it, garlic helps control blood sugar and provides a profound protective effect on your blood vessels. The science is clear, from cancer research in Europe, demonstrating its anti-cancer effects to its ability to treat arthritis and any condition ending in the letters litis. That suffix is the medical term for inflammation, so whether it's bursitis, tendinitis, or arthritis, Garlic's powerful anti-inflammatory nature can be incredibly useful. Now let's zero in on our main topic today, your heart. More than 40 clinical trials have shown the significant benefits of using garlic for the cardiovascular system. As I mentioned, one of those studies revealed that the relative risk of heart attacks and strokes could be reduced by more than 50%. With such a tremendous life-saving benefit, the question remains, why isn't every single person adding garlic to their diet regularly? To understand that, let's dive into our first major benefit. Garlic helps to thin the blood and prevent dangerous clots. To understand how it does this, we need to talk about a compound in your body called thromboxane. Now, I won't get too deep into the chemistry, but what you need to know is that platelets are tiny cell fragments that rush to the site of an injury to form a clot and stop you from bleeding. This is a good thing if you have a cut. But when thromboxane levels are too high due to chronic inflammation, it can cause platelets to stick together inside your arteries, forming a clot where there is no injury. This unwanted clot can get lodged in the small blood vessels of your heart, blocking blood flow and causing a heart attack. Or it can break loose, travel up to the arteries in your brain, and cause a devastating stroke. Thromboxane also causes something called vasoconstriction, which means it makes your arteries clamp down and narrow, especially the vital coronary arteries that supply your heart muscle with blood. This clamping down is related to a condition called angina, or chest pain. It is essential to understand the difference between the two main types of angina. First, there is unstable angina, which is a true medical emergency. This condition is often associated with a vasospastic event, where the coronary arteries suddenly spasm and clamp down, severely restricting blood flow. The real danger with unstable angina lies in the nature of the plaque buildup inside the artery. In this case, the plaque is soft, inflamed, and vulnerable, like a ticking time bomb. It has a very high risk of rupturing spontaneously without any clear trigger. When this unstable plaque breaks open, the body rushes to form a clot, which can then cause a heart attack or stroke. A defining characteristic of unstable angina is its unpredictability. The pain can strike out of the blue even when you are completely at rest, perhaps waking you from sleep in the middle of the night. Any new, changing, or unexpected chest pain that occurs at rest should be treated as an urgent medical situation. In contrast, stable angina operates on a more predictable pattern. While it also involves plaque, this plaque is typically older, harder, and protected by a thick fibrous cap, almost like a callus. This makes it far less likely to rupture unexpectedly. Instead, the pain of stable angina is consistently triggered by physical exertion or emotional stress. You might feel it when you walk up a flight of stairs or carry heavy groceries. Crucially, the pain typically subsides within a few minutes of stopping the activity and resting. Now, what does this have to do with garlic? Well, some of the most powerful medications we have, like blood thinners and even aspirin, work by inhibiting the action of thromboxane. But here is the amazing part. Garlic contains several natural compounds that also act as powerful inhibitors for thromboxane, but without the side effects associated with long-term medication use. Olive oil also has this incredible ability. By naturally reducing the stickiness of your platelets, garlic makes you far less likely to form those dangerous, life-threatening clots. The second major benefit is that garlic helps to lower blood pressure and soften your arteries. As we just learned, thromboxane is a very powerful vasoconstrictor. When levels of this compound are too high in your body, it's like a clamp is constantly squeezing your arteries, which forces your heart to work much harder to pump blood. This leads directly to high blood pressure. By inhibiting thromboxane, garlic naturally helps your blood vessels to relax and widen, which in turn lowers your blood pressure. But it goes even deeper than that. Remember how we discussed insulin resistance? Chronically high insulin is a major cause of stiff, inflexible arteries. It damages the arterial walls and reduces their elasticity. because garlic has been shown to help lower insulin and improve insulin resistance. It helps to restore the natural softness and flexibility of your arteries. This is a profound benefit. Flexible arteries can better accommodate the flow of blood, which further helps to regulate and normalize your blood pressure. Think of your arteries like a garden hose. A new flexible hose expands easily with the pressure of the water. An old sun-baked hose is stiff and brittle and can't handle the pressure. Garlic helps keep your arteries more like that new flexible hose. Our third incredible benefit is that garlic helps to clean out your arteries by lowering your calcium score and balancing cholesterol. There is an excellent test, perhaps one of the single most accurate predictors of a future heart attack, called the calcium score test. This is a special type of CT scan that measures the amount of calcified plaque in your coronary arteries. Ideally, your score should be 0. A score over 400 or 500, and certainly over 1,000, can strongly predict your risk of a heart attack. It is a very good test to ask your doctor about. But here is the truly exciting part. Garlic can help lower that calcium score. It helps your body to remove the excess calcium that contributes to the hardening of plaque in your arteries. In studies where powerful statin drugs were used to try and lower this score, they were unsuccessful. But garlic, this humble plant, can help bring that dangerous number down. Garlic can also help to balance your lipid and cholesterol levels. It does this by helping your body produce more bile. Bile is a substance made by your liver and stored in your gallbladder, and it is the primary tool your body uses to break down fats and get rid of excess cholesterol. By increasing the flow of bile, garlic essentially gives your body a more powerful and effective cholesterol cleanup mechanism. It helps your body to naturally move excess cholesterol and other lipids out of the arteries and out of the body. The fourth major benefit is that garlic helps fight heart-related infections. Remember that garlic is highly antibacterial. It works on viruses, fungi, and bacteria. This is incredibly important for protecting against a serious heart-related issue called bacterial endocarditis. This is an infection sometimes caused by staph bacteria or even a fungus that forms colonies or biofilms right inside your arteries or on your heart valves. These infections are notoriously difficult to treat and can be very dangerous, but garlic can act as a natural antibiotic to help fight this condition without the side effects that often come with pharmaceutical antibiotics. This is just one more way that garlic acts as a guardian for your entire cardiovascular system, protecting it from invaders that could cause serious harm. This leads us to our fifth and final benefit, which really ties everything together. Garlic helps reduce system-wide inflammation, addressing the root cause of heart disease. As we've discussed, heart disease doesn't just happen overnight. It starts with inflammation inside the arteries. Risk factors like smoking, obesity, diabetes, high blood pressure, stress, and especially insulin resistance all cause this underlying inflammation. When the inner wall of an artery becomes inflamed and damaged, the body tries to heal it. It creates a sort of internal Band-Aid out of cholesterol, calcium, and protein. This Band-Aid is what we call plaque. By being a powerful antiviral, antifungal, and antibacterial agent, and by improving insulin resistance, garlic tackles the primary sources of this inflammation. It calms the internal fire. When you reduce the overall inflammatory burden on your body, you reduce the initial damage to your arteries. This means your body doesn't need to create as much plaque in the first place. It's a proactive, preventative approach that addresses the problem at its very root. So, to recap the main points, garlic helps thin the blood so you're less likely to form dangerous clots. It helps regulate blood pressure and fights against the constriction of your blood vessels. It can help soften the arteries and remove excess calcium, lowering your calcium score. It helps move excess cholesterol and other lipids out of the arteries by increasing bile production. And it's antibacterial, helping to fight infections that can affect the heart. I honestly do not see why someone wouldn't use garlic regularly for its immense cardiovascular benefits alone. All right, so how do you make this incredibly complicated garlic water? Yes, of course, I am being sarcastic. It could not be simpler. Here is the recipe. First, crush 1 clove of garlic. Second, put it in a glass of water, about 8 to 12 ounces. Third, add 1 teaspoon of extra virgin olive oil. Finally, and this step is very important, let it sit for about 15 minutes. We let it sit because we want all the powerful phytonutrients to be released from the garlic after you crush it. The chemical reaction that creates the most beneficial compounds only happens when the garlic clove is damaged. We add the olive oil not just because it also helps to reduce that thromboxane compound we talked about, but also to help your body absorb these phytonutrients, since many of them are fat-soluble. Now, you don't have to make garlic water. You can simply add fresh crushed garlic to your food. You can also take it in supplement form. There are probably 100 different ways to get your garlic in. Just be sure that your garlic doesn't come from China, as there have been concerns about the agricultural practices used there, such as growing it with chlorine-based chemicals and using sewage as fertilizer. So, please try to buy your garlic from a local source, or even better, grow it yourself. It's quite easy to do. Thank you for joining me today. I hope you'll consider making garlic a regular part of your heart protection plan. Please be sure to check out our other videos on the early warning signs of a stroke and how you can prevent one. If you found this information valuable, please give this video a thumbs up, subscribe to our channel, and share it with someone you love. It could make all the difference. Ladies and gentlemen, we have just concluded a profound journey into the world of garlic, uncovering a natural medicine whose benefits have been validated across more than 40 clinical trials, demonstrating its power to reduce the relative risk of a heart attack or stroke by more than 50%. This isn't folklore. It is robust, undeniable science. The fundamental core value and enduring message we've extracted is this: optimal cardiovascular health is not reserved for complex, high-cost solutions, but can be found in a humble, accessible, and potent ingredient that is likely in your kitchen right now. The only logical reason why garlic has not become a primary, widely prescribed medicine for heart conditions, in my opinion, is simply because there is no profit to be made from a plant that anyone can grow in their own backyard. Comprehensive summary of core benefits and scientific mechanisms. To ensure these vital facts are cemented in your mind, let us quickly recap the 5 most significant ways garlic impacts your heart and the entire cardiovascular system. 1. Holistic protection. Against the root cause, chronic inflammation, garlic is a powerful, full-body defender with potent antiviral, antifungal against issues like Candida, and antibacterial against serious threats like H. pylori properties. By clearing up these persistent low-level invaders, garlic significantly reduces the constant burden on your immune system. This directly calms the slow-burning fire of chronic inflammation, which damages the delicate inner lining of your blood vessels and sets the stage for heart disease. Crucially, garlic addresses one of the deepest root causes of all, insulin resistance. Chronically high insulin is not just a precursor to diabetes. It is a highly inflammatory hormone that directly causes the hardening of your artery walls. 2. Anti-clotting action. A natural blood thinner, garlic contains several natural compounds that act as potent inhibitors of a substance called thromboxane. Thromboxane's job is to make the platelets in your blood sticky. While this is necessary for healing a cut, chronically high levels cause platelets to clump together inside your arteries, forming the dangerous clots that travel to your heart, causing a heart attack, or to your brain, causing a stroke. By naturally reducing platelet stickiness, garlic helps ensure smooth, free-flowing blood, providing a remarkable protective shield against catastrophic cardiac events. 3. Artery softening and blood pressure regulation. Thromboxane is also a very powerful vasoconstrictor, meaning it forces your arteries to clamp down and narrow, which directly leads to high blood pressure. Garlic helps inhibit this action, allowing your blood vessels to relax and widen. More profoundly, by helping to improve insulin sensitivity, garlic aids in restoring the natural elasticity and flexibility of your artery walls. Think of your arteries reverting from an old, brittle garden hose to a new, flexible one, better able to handle blood pressure surges. 4. Vascular cleansing and lipid balance. The humble garlic bulb has been shown to help your body remove excess calcium, an ingredient in hardened plaque, and can potentially help lower your calcium score, an achievement that powerful statin drugs have failed to consistently demonstrate in studies. Furthermore, garlic boosts the liver's production of bile. Bile is the body's primary mechanism for breaking down fats and ushering excess cholesterol and other lipids out of the arteries and out of the body entirely. 5. Guarding against heart-related infections. Its superior antibacterial and antifungal power means garlic acts as a natural guardian against severe heart conditions like bacterial endocarditis, an infection where bacteria or fungus can form dangerous colonies on your heart valves and within your arteries. Garlic offers a natural line of defense against these difficult-to-treat invaders. Second, final call to action. In summation, from reducing inflammation at the deepest cellular level and softening your arteries, to acting as a natural anti-clotting agent and cleansing your vessels of plaque ingredients, garlic is a truly comprehensive protector for your cardiovascular system. With the science so overwhelmingly clear and the benefits so immense, the question is not if you should use garlic, but how often. I urge you to start with the incredibly simple garlic water recipe. Crush 1 fresh clove of garlic. Place it in a glass of water, about 8 to 12 ounces. Add 1 teaspoon of extra virgin olive oil. Crucially, let it sit for about 15 minutes. This allows the necessary chemical reaction to take place after crushing, releasing the most powerful therapeutic compounds. The olive oil helps with the absorption of fat-soluble nutrients and adds its own thromboxane inhibiting properties. Whether through this water or by adding fresh crushed garlic directly to your meals, commit to a consistent routine. And please prioritize your health by sourcing your garlic locally or even growing it yourself, ensuring you avoid products with questionable agricultural practices. Finally, I must reiterate the most important advice. Garlic is a magnificent supporting tool, but it is not a replacement for professional medical care. Always consult your physician before making any major changes to your health regimen, especially if you are taking blood thinners or blood pressure medication.